In Greek mythology, Atlas, the Titan, led a war against the Olympian gods for control over the earth. Zeus punished Atlas the Titan for this by making Atlas responsible for bearing the weight of the earth on his shoulders for all of eternity. You have a Titan in you that is solely responsible for holding up your head. The Atlas is the topmost bone, sitting just below the skull. The Atlas supports the skull, facilitates neck movement, and protects the spinal cord. A titanic job for one bone. The Atlas vertebra weighs a mere 2 ounces, and the human head weighs 9 to 17 pounds, hence the likeness to Atlas the Titan, the figure in Greek mythology who carried the world on his shoulders. Many years of clinical research point to the fact that many of the symptoms you have experienced may be associated with spinal misalignment of the Atlas bone. This one bone can affect the alignment of the entire spine and affects overall health. The spine is like a chain. When the first link is twisted and turned, each link down to the last turns, thereby disrupting the rest of the chain. Consider the Atlas the first and therefore the most important link in that chain. The human body is balanced when the head is positioned in the center of the feet. When the Atlas is misaligned, it causes the head to tilt. The spine then shifts to support the weight of the head, thereby creating biomechanical and postural stresses and strains. When the Atlas bone is properly aligned, that is in the orthogonal position, the rest of the spinal vertebra come into better alignment, allowing the body to heal itself and alleviate you of symptoms you may be suffering. The Atlas supports the weight of the head most efficiently in the orthogonal position. Atlas orthogonal is a bioengineering term referring to the position of the Atlas of 90 degrees to the head and neck. What can cause misalignment of the Atlas? Trauma in one form or another is the primary cause of misalignment. When the Atlas vertebra is subjected to stresses and strains, it may be pushed out of proper alignment. Trauma may include car accidents no matter how minor and regardless of immediate symptoms, slips and falls, blows to the head, or sports-related injuries. Repetitive microtraumas such as bad sleeping habits, poor posture, incorrect lifting and carrying can also cause misalignment. Have you ever had a teacup on one of those fancy saucers? If the teacup is not placed on the saucer in the exact position on the center of the saucer, what happens? The cup is misaligned on the saucer and you spill your tea. Just like your head on the Atlas if not properly aligned. Once the Atlas is moved out of its orthogonal position, the body tries to compensate to maintain its center of gravity. It does this by keeping the head directly over the center of the feet. However, to maintain the vertical position of the head, the body alters its structure in such a way that the muscles contract to cause one leg to appear shorter. In most cases, one leg is actually not shorter than the other, but is drawn short due to the body's compensation for the displaced Atlas. The resulting misalignment may cause nerve pressure and inflammation, causing a disruption of the normal functioning of the nervous system. This one dysfunction may play a role in a multitude of symptoms and pain in different areas of the body. Besides directly impacting the neck, we can see other effects such as decreased curves in the neck, scoliosis, and changes in the alignment in the shoulders and pelvis. These changes in the alignment affect the structural integrity of the skeletal system. This in turn can result in a host of other symptoms and problems, especially headaches, neck, and facial pain. An Atlas orthogonist treats this condition through a system of examination and diagnosis that utilizes a detailed scientific and biomechanical protocol. Precise measurements of the angle of the Atlas are the basis of the treatments. An extensive evaluation of the patient's condition is rendered by the doctor on the first visit. The first step of the diagnosis is to determine the degree in which the Atlas is misaligned. Very precise X-rays are taken and would show the doctor exactly how the Atlas is displaced. The X-rays taken are invaluable in making the most precise Atlas correction, which is as unique to the patient as their own fingerprint. Following the diagnosis, a specific treatment protocol is developed to align the atlas into the correct neutral or orthogonal position. One of the most important post-adjustment steps are post-X-rays, which are taken immediately after the initial treatments. There is no guesswork in this program. These three-dimensional X-rays are taken and analyzed to verify that the best possible correction was rendered. Dr. Sweat invented and engineered a highly advanced instrument that without pain or pressure is able to accurately reposition the atlas vertebra. The procedure is non-invasive and gentle. The atlas procedure is a chiropractic specialty that uses precise treatment without drugs, surgery, or spinal manipulation. An exact amount of energy is used to align the atlas. A precise instrument is used rather than the doctor's hands. The results are often very immediate and dramatic. Without proper treatment, the symptoms only get worse and the problem becomes more difficult to correct. Optimum health starts and ends at the proper alignment of the atlas. If you are experiencing symptoms, make an appointment to get your atlas checked and carry your head high again.